Hello everyone. I welcome you all to this nursing academic webinar, and today the topic is on iron deficiency anemia in pregnant women. We will also see the little awareness on the FOGSI FOGSI update, and we will also have one review of literature. Having said so, let me also let me introduce Dr. Anita. I'm sorry, I'm lacking the word because a lot of shift here. Let me introduce Dr. Anita Kunaya Garu, who is our senior consultant and OBG specialist. She's very highly competent and a laparoscopic surgeon, robotic surgeon, and infertility specialist, also practicing at Yashoda Hospital, High Tech City. Let me also welcome our senior nurse manager, Ms. Leela, who is a senior nurse manager looking after the medical surgical area and a quality nursing supervisor also. Let me welcome you both here in this session. Why we have chosen the topic on iron deficiency anemia in a pregnant woman or among pregnant women is, I think this is one of the very common disorder we likely to see in the pregnant woman, and it adversely affects the maternal and fetal well-being. Instead, the 35% of reproductive age of women's group, they are affected with. So let us see what we have in today's webinar. Over to you, Leela.
Thank you, ma'am, for your lovely introduction. Hello, everyone. I am Leela here to present on iron deficiency anemia during pregnancy. So what is iron deficiency anemia? Nice. Iron deficiency anemia occurs when body doesn't have enough ions. Ions help make red blood cells, but in anemia, blood doesn't have adequate healthy red blood cells. Iron deficiency anemia is a common type of anemia. The greater iron requirements group of grooming children and pregnant women who is particularly at risk. Now, what is red blood cells? The red blood cells is also known as red cells. The most common type of blood cells and its principal means of delivering oxygen to blood tissue via blood flow through the circulatory system. So, signs and symptoms. Iron deficiency anemia during pregnancy is nothing but headache, pale skin, dizziness, blitterness. Brittle nails is nothing but cracked, split nails, and heart palpitations, irregular heartbeats, leg cramps, and slow blood loss. Over to you, Shanti ma'am.
To you here is, what are just now Leela has discussed a few different signs and symptoms. What is anticipated or when it is diagnosed that pregnant woman has or mother has anemia? Apart from these sign symptoms, does she also has other symptoms?
Thank you, Shanti. Thanks for a lovely introduction. It's a very important topic what you have selected. What I want to tell is that in pregnancy I'm talking about, it itself is a physiological, lot of changes happens. So most of the time, whatever symptoms you have highlighted here, itself is considered as a normal symptoms in pregnancy, which is most of the time confused in many of us. Yes. You're feeling tiredness, yes, you're pregnant, that's the reason you're tired. You're feeling loss of appetite, yes, you're pregnant, you're not feeling any food cravings. You're feeling very weak, yes, you're pregnant, you have physiological changes. But remember, anemia signs are commonly seen in women because most of them enter their pregnancy phase already within their anemic. Yes. 90% of us, 90% of women are anemic. In this webinar, if I take a statistical count, 90% of us will have an HB, not more than 9 to 10. It means our women are entering in a phase of pregnancy pre-existing anemia itself. So other than this symptoms highlighted, Leela, there are other symptoms like, you feel loss of appetite. The moment we correct anemia, the appetite will increase so nice that the woman will start eating well. Second is tingling and numbing sensation in your fingers. Is again one of the symptoms. Sometimes majority of women are working now. Lack of concentration and focus in their work, lot of exhaustion, can't focus in the system of the computer, early fatigue in their work. These are all other symptoms which should be seriously looked into. And anemia is one of the common symptoms, often misdiagnosed as a physiological symptoms. Okay.
So I think many of us experiences a lot of fatigue and we think this is a work related, but we do not know that underlying cause also can be one iron deficiency anemia as well. Over to you, Leela.
Let me move on to Pica. Pica is an eating disorder in which there is an appalling desire to lick or eat non-food such as gypsum, chalk, soils, and papers is prevalent in pregnant women.
I mean, I was just, by reading this, I was just smiling to myself because I think everybody has gone through this phase of Pica. And as I was going through a lot of guidelines where 47% of women are affected with Pica. Do you think, ma'am, how do you manage? Like any woman, antenatal mother walks to your OP, and maybe we nurses would like to know whether still you as a specialist, whether you handle the Pica, how do you handle them, what teaching do you give, and how do they react? Because I think this is more prevalent in the among the antenatal mothers. So what is your take on it, ma'am?
Yes, I'll tell you in a simple way. Pregnancy is a beautiful phase, Shanti. But at the same time, we have some odd, weird, strange food cravings. You know, sometimes the food which is favorite to us may not be any more favorite. The food which is really not good, no, we feel like eating them. This is all because of the hormone changes which is happening in the pregnancy. But at the same time, you should think that food cravings are commonly seen in pregnancy, but Pica is a condition when there's a desire to eat non-food items. As Leela already mentioned it, chalk, soil, paper, gypsum. Sometimes, we ourselves have seen they go toward the wall, scrape it and eat some uncooked rice.
Yes.
Okay, this is a Pica, what we commonly see. In pregnancy, maybe these symptoms will aggravate. The reason is that because of a lot of hormones which is produced in the body, which is causing a lot of nausea and indigestion, to get rid of their satiety, they get this Pica symptom little more. But remember, they may get a satiety with the food items, not with the non-food items. Non-food items is the craving more than the food items. Again, it is a sign of nutritional deficiency, which is again commonly the iron deficiency anemia itself. So it becomes important for us to rule out iron deficiency in pregnancy. Of course, yes, remotely we also think about if this Pica symptoms is very uncontrollable. There are mothers who cannot control, they go hide and eat it. They don't even tell. They come with severe symptoms of stomach pain and vomiting. This is something not related to physiological changes. This should be some form of obsessive compulsive disorders or a mental health issues as well. So Pica symptoms may be there, but symptoms very bad, again should be rethink, correct the nutritional deficiency, and also please take a family into the loophole and help her with these mental health disturbances as well.
Yes.
Right.
Yes, that's what I think. I was very surprised to see whether, when women are asked to stop this disorder, I mean, the food which they eat, which doesn't have any nutritional value. And I was surprised to see that 63% mothers, they don't feel comfortable when they are asked to stop. Yes. So over to you, Leela. Thank you, ma'am.
Now, in this slide, we can see the difference between normal red blood cells and anemia red blood cells of pregnant woman who is anemic. These are the 3 types of anemia affecting the pregnant woman, like iron deficiency anemia, folate deficiency anemia, and vitamin B12 deficiency anemia. Let us understand the physiology anemia of pregnancy. During pregnancy, the maternal plasma volume gradually expands by 50% and increase of approximately by 1200 ml. Most of the raise takes place before 32 to 34 weeks of gestation. The total increase in red blood cells is 25%, approximately 300 ml that occurs later in pregnancy. However, the physiology alteration of pregnancy necessary for the development of fetus.
So, ma'am, like maybe when you are busy in your OPD and you see a person or maybe unplanned visit to you, and what your gynec nurse should ask or pre-assess the patient for? Should she ask or should we anticipate that patient might walk with the total HB screening or kind of iron test, or what what education we should provide to the gynec nurse?
I think I feel our nurses are the backbone of our healthcare system. Believe me, Shanti, we may be busy in our schedules with our patients, but our nurses play a tremendous role. They are the initial person who come in contact with the patient, and they themselves can educate the importance of getting their hemoglobin checked and correction of anemia. They may not go into depth of investigations, but their awareness will bring a lot of awareness to our patients as well. I feel each and every nurses in our OPD should be trained and should be alerted to ask our patients that whether they have done their basic hemoglobin test in first trimester, even if they've not done in second trimester, please repeat their hemoglobin somewhere between 32 to 34 weeks, because this is a period of maximum hemodilution. And this is the time when the maximum drop of HB will happen. And we also have an ample of time of 8 weeks till the delivery, where we can definitely correct her hemoglobin and bring her to a safer level of HB, so that she can have a safer delivery and have less complications during a pregnancy and postpartum, because all of us are aware delivery without blood loss is impossible.
Impossible.
So there is a blood loss of approximately 300 ml, normally as well, C-section little more, but loss is definite. So I think if we looked into this matter, our nurses are a backbone and they do a wonderful job to educate our patients and of course, bring out our stress also a little bit less.
Thank you so much for that acknowledgement, ma'am. Thank you. And over to you, Lina.
So now let us see what are the potential causes and risk factors of anemia during pregnancy. The pregnancy itself is a cause of anemia because of the increase in blood volume. Now, we will go through the potential causes. 2 or more closely pregnancy, pregnant with more than one baby, vomiting frequently during morning sickness, less consumption of iron-rich food, heavy pregnancy menstrual flow, and before pregnancy history of anemia. Risk factors as it is shown in the slides. Now, why anemia during pregnancy? It is because increased demand of iron, diminishes intake of iron, disturbed metabolism, pre-pregnant health status, and the last one is like multiple pregnancy.
So, ma'am, if I talk about a woman comes to you with a disturbed metabolism, and how would what are the measures we give to her, and what could be her worry, and what prevention or precaution steps she should take home?
Well, Shanti, disturbed metabolism is a broad terminology itself. So what I want to tell you is that our lifestyle has really changed, Shanti. It is not like what it was before. Most of us, majority, are working. Now the part is that our role play in a working field, our role play as a mother, as being a homemaker is doubled up. Yes. So in this point of scenario, our concentration for ourselves, giving time to ourselves, eating food on time, physical activity, all these are tremendously getting disturbed. Let me tell you, Shanti, every weekend when we see the OPD and an IT crowd, they are working. All are working women. But the thing is that they are sedentary lifestyle. They're lacking so much of physical activity. They eat on odd time. They sleep on odd hours. They take odd hours of call time. Let me tell you, ours is a circadian rhythm. If this rhythm gets disturbed, our entire metabolic system will get disturbed. Yes. Coming, for example, is, as I told you, lack of nutrition. The biggest topic is iron deficiency anemia itself. Second is diabetes. More and more diabetic women we are coming across in pregnancy. This is because, again, our lifestyle, again, the way we are eating, a lot of processed foods and lack of physical activity, obesity. Most of our mothers now are so planning that they're postponing their fertility period, postponing their pregnancy itself is causing an impaction on their fertility and pregnancy complications like medical problems. Other than diabetes, we see hypertension, dyslipidemias, and entire hour they work. At the end, they don't even get a time to take care of their body itself with a lot of exercises and physical activity. That itself will cause metabolic disorders, and this is going to be a biggest global impact in coming era. So I think every one of us should be alerted from now that if you're planning, pre-pregnancy counseling becomes a very important, not only to screen them for anemia, to correct them for anemia, to tell them what is a good diet, to modulate them with the physical activity and make them fit for pregnancy physically, mentally, biologically.
Now, increase of major risk. During pregnancy, iron deficiency, most common anemia, increases the risk of sepsis, maternal mortality, prenatal mortality, and low birth weight.
So I think low birth weight is the major risk associated with this condition, ma'am. So what is your opinion on the same? With such conditions, how do we manage it?
You mean to say regarding the body mass index?
Yes, ma'am.
Okay.
Yes.
Shanti, every one of us, it's not pregnant women itself, every one of us should know what is a BMI, that is body mass index. We have a set and done criteria that this amount of height, this amount of weight, this amount of calories required for us to maintain our basal body metabolism. And if anything more or anything less leads to an abnormal impact on our health sectors. So how do we do it? This is called as a BMI or a body mass index. There are many applications or simple way to calculate this BMI. Anything less than 18.5 BMI, it is an underweight. Anything between 18.5 to 21 is normal. Anything between 25 is overweight. Anything more than 30 is obesity. Anything more than 40 is morbidly obesity. So every one of us should know what my body needs, how much it needs, depending on my food habits, depending on how physically active I am. The same food may not be suitable for me and a person who is working in a field, and the woman who is working a sedentary lifestyle. Their requirement is different, my requirement is different. Some may be a vegetarian, some may be a non-vegetarian. So my food intake, my metabolism depends on how much height I am, how much weight is required for me. And based on that, if you maintain this BMI, our metabolic system will be in a physiological control. Otherwise, extremes of underweight causes extremes of impact on a pregnant woman during a delivery, causing an impact on the child growth, causing a low birth weight babies, difficult delivery, loss of blood loss, already she's an anemic, isn't it? Infections, lactation problems, mental stress. She will not even have an energy to bear her labor pains. So I think this should be seriously looked into. And again, I tell you, preconceptional counseling and tuning up of our mothers, educating our mothers can reduce these point of problems.
I think pre-counseling time, we also need to, involve our nutritionist who can always value-added point they can provide to the pregnant mother. Over to you, Leela.
So let us see the nursing management on iron deficiency anemia during pregnancy. The goal is to identify and treat the cause of the folate deficiency. The folic acid supplements oral or via IV on short-term basis until the anemia has been corrected, and dietary treatment like green leafy vegetables and fruits. The goal of treatment is to continue the manage and control system. Like folic acid, help us new blood cells, new red blood cells, pain medications, and plenty of fluid. To eat vitamin C rich food, to take parental multivitamins and mineral pills. So these are the few glimpses of iron-rich diet, vitamin B12, and green leafy vegetables like fish, meat, cheese, and these are the few iron diets. And this is the pregnancy food pyramid, like fatty sugars, fat sugars, dairies, protein, and fruits.
So, ma'am, what are the oral and folic acid supplements do we prescribe to the pregnant woman, and what precautions she should be taking when she's on these supplements?
Whenever there is a hemoglobin synthesis, you know that hemoglobin is the one which carries the iron, and that is the one which corrects our anemia, and that is very important for us. So we need some vitamins in order to form this process. Most important is a folic acid and vitamin B12. So it is very important that we are aware of this. It is recommended from the WHO that every pregnant woman or a mother who is planning for pregnancy 2 to 3 months prior to start folic acid tablet, a small vitamin tablet of 5 milligrams every day, once a day after breakfast, 2 to 3 months pre-conception itself. But in practical, most of them come by the time she's pregnant. They'll be very happy with showing us the results, but already she will have pre-existing anemia. Already she'll be in anemic state. So in order to do the preventive measures, this is the one which we recommend by WHO and FOGSI guidelines, that every mother should start taking 5 milligrams of folic acid every day. Other than that, as Leela has already put so many beautiful slides here, wonderfully depicted graphs here, the pyramid, whatever she's showing here, itself shows that what portion of the food should be more and what portion should be the last. It means the fat, the sugars, and the oil-based preparation should be the last, because they're all processed foods and they should be minimum. Your baseline is rich of cereals, pulses, vegetables, dry fruits, are rich in our folic acid and vitamins. Again, vitamin B12 is also equally important, because if this deficiency land up, we get a hemoglobin deficiency called as megaloblastic anemia. And this source is usually a non-vegetarian source. So for a vegetarian, again, there'll be a little bit of vitamin B12 deficiency, but we can correct it with a supplementation by injectable forms. Folic acid is usually oral forms. All the mother needs this folic acid supplement, pre-conceptional 5 milligram once a day to 3 months, that is 12 completed weeks of pregnancy, mandatory.
Leela, I think we are time bound, and then we can just quickly run the slides.
Yes. Let us understand the hemoglobin cutoff in pregnancy as per the given guidelines like WHO, FOGSI, and International Council of Medical Research. First, second, and third trimesters, the normal HB level would be like 10 to 11 grams per DL, and coming to ICMR guidelines, less than 4 will be considered as severe HB.
So what clinical intervention we should be taking, ma'am, when we see the during pre-pregnant gravid state when the HB is lower than 4 and more than 7?
I'll sum up in a shorter time because we are running out of time. One is important thing is that whenever we want to correct the HB, our target should be minimum 10.5 to 11. But remember that we need to have time also. Time in the sense the delivery date. It is very, very important. Imagine a mother coming with 6 grams of HB and you're counseling her for a diet when she's already 38 weeks. It's impossible for you to correct. So it's very important that depending on the trimester of the pregnancy to take the measures. If she's in first trimester, you have ample of time, add on with diet and iron supplements. Second trimester, diet with iron injection if the hemoglobin is less than 6, otherwise still diet can help her. Third trimester, because we lack of time, you have to supplement faster because she'll deliver. So if she's severely anemic, iron supplementation still role play 2 weeks, otherwise sometimes even blood transfusion, severe anemia during labor as well.
So FOGSI recommendations like control of hookworms, malaria, and other infections. The physiological demand for iron during pregnancy is 3 times higher. The calcium is essential nutrition during pregnancy. And parenteral iron therapy indicates in patients with iron deficiency anemia. Oral iron tablets are very effective at replacing in iron need for hemoglobin. Iron tablets can also come with folic acid and vitamin C. Consider blood transfusions if recommended.
So, ma'am, sorry to interrupt, Leela, this deworming practices, we do it on the therapeutic index, or what side effects a woman will have? Or should we do it just because we have observed her iron level is low and ferritin is not picking up like that? So what is your opinion on that?
CDC guidelines, the Control of Disease and Prevention guidelines, clearly tells that there was a lot of misconception regarding a deworming in pregnancy way back. but it is no more like that. So every mother, because most of us are exposed to so much of roundworm infection, helminthal infections, food eating outside, cat, pets, etc., poor hygiene of the mother's background, isn't it? So every mother should be dewormed. That is safer period is after first trimester. 1 tablet of albendazole, 400 milligrams, 1 stat we give it. So this is a recommended dose. We give it in second or third trimester. There are very minimal side effect to this tablet, but it is recommended to give it, not way back what the thought process was. I think it should be a routine practice rather than thinking whether she's anemic or not.
Oh, lovely update on the same, because we think that when during the trimester taking the pills are not safe for the pregnancy and for the fetus. So let us also see the review of literature on by the European Journal of Medical and Health Sciences, where it is depicted that the high prevalence of anemia in developing nations are just because of malnutrition, low micronutrient bioavailability, and many other factors like insufficient consumption of iron. So let me also conclude. So anemia, all we have seen, the beautiful discussions went on very well. Thank you so much, Anita ma'am. And because you are here, the lovely discussion went on very well. I think this anemia is very common among the pregnant women, and early detection is a prevention to key. Thank you so much. And thank you, Leela, for the beautiful presentation. And ma'am, your last message on the same. You would like to give.
I'll tell you one simple message. Girls, first go and get your HP test for yourself first, isn't it? 90% of the women are all anemic because we bleed and menstrual blood loss is there, and most of us don't eat well. In our India, preference to, again, there is a preference, isn't it? We always sacrifice our thing to our family. Please take care of yourself. Your health is more important than anything. If you are healthy, your family is healthy, entire nation is healthy. Correct your anemia, educate our pregnant women to please screen themselves, educate on nutrition and the need of supplementation. Thank you.
Thank you so much, ma'am. It was always the lovely moment and very remarkable journey working with you, and I'm sure every nurses would love to work with you. Thanks for that enthusiasm, and you always empower the nurses, and not only nurses, every team member. Thank you so much. Thank you, Neela.
Thank you.
That's how we end the session.
Wonderful presentation. Hats off to all you girls. Beautiful. Very good.
Thank you, ma'am.
Yes.
And so remind everybody about, again, then next Thursday, we will connect for the other OBG series. Thank you so much. Stay connected and tune well. Thank you.